Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, without wasting any time, let's get started. Coming to the slide 1, these are the must read questions which are frequently asked in exams and are absolutely non negotiable. Make sure you understand them properly and revise them multiple times. So, speaking about the 10 markers, there are 4 10 markers which I have mentioned here, and it's important to note that usually the 10 marker from the paper 1, the question will be from the general pharmacology. So they have been kept asking one or the other questions from these 4 alternatively. So make sure you have studied all those 4 questions very well. And then 5 marker questions, I have mentioned 10 questions here. In that, methods to prolong drug action, they have been asking that question in the last 5 years very frequently. It may not have been mentioned in your Singi latest, because the latest supplementary exams they have not mentioned in that book. But after analyzing those question papers, trust me, this question they are loving too much in these days. Apart from that, drug antagonism, transdermal route. See, in the 10 marker, I have mentioned a question where I wrote various route of drug administration and IV route or oral route. The thing is, 90% times they ask the IV route, but the IV route, oral route, and transdermal route, all the 3 questions are very important 5 marker question. So it's better while learning that, learn all these 3, which will help you in the long run. Apart from that, teratogenicity, they is also a very important question. Plasma half-life, microsomal enzyme induction, plasma protein binding, and drug synergism are the other important questions. Then 3 markers, I have mentioned 15 questions, and all these are important. Among that, pro-drug, it's like the favorite of examiner. They have been repeated so many times. So all these questions, never miss it. Giving you an extra tip, if you prepare only this slide properly, you can confidently attempt most exam questions from the general pharmacology without mistake. So it's that important. Next, coming to the good to read questions. See, drug antagonism, they have asked that question one time before, so it's better if you just see that once. Okay, and then other than that, yeah, these are the questions which are commonly asked but slightly less frequent than the must read ones. So they are important for short notes and viva, but yeah, for the theory exams, I mean, the most highly likely chances are must read, but yeah, these if I being honest, okay, these questions they usually ask in your internals because they want to test your knowledge. So these are those questions which will fetch you extra marks. So prepare these well once you have read the must read topics very well. So these questions will help you in scoring those extra marks. So yeah, I have mentioned all those questions. There is no point in reading all those. You can take a screenshot and refer it. Now let's see the final category, that is may read questions. So these are less frequently asked, but they are still useful for concept clarity and long-term understanding. Now the chances of these questions coming in your exam is very very least. If I give you the 10 chapters, and if you consider all the may read questions from 10 chapters, probably in one chapter one question may come. It's that less frequency. So yeah, if you have done with all the chapters and you have time, just look into it. Of course they can help you in the viva and getting into that good zone of examiner. I mean, in the examiner's eyes you will become like, okay, even if you answer all those other viva questions, they come here, and if you answer, it will be very good for you. So that's yeah, so that's it for today's video. I hope this must read, good to read, and may read classification helps you plan your general pharmacology revision more effectively. And if you found this video helpful, like the video, subscribe to the channel, and don't forget to turn on the notification bell. I wish you all the very best for your exams. Study smart, stay confident, and keep learning. Thank you so much for watching. See you in the next video.